Okay, thank you very much. Well, as some of you know, I'm Ilora Finlay, and I just got less than 5 minutes, I think, just to give you a little bit of a rundown and intro. So I've put a few slides together, which I hope might help. I know that you've got workshops now on different aspects of companionship in dying, and I thought it's really worth remembering firstly about the Mental Capacity Act, and that provides a framework within which people should work. And sadly, it's unfortunate, but if you look at the elderly, about 1 in 5 of our elderly population have been affected by abuse in some way or another. So whenever you're with people who are in any difficult situation, just remember those bits of communication. You listen with your ears, but you also look with your eyes and you see what's going on. You listen with your undivided attention and from the heart. And in your mind, you integrate all that you hear and ask yourself, do you know what matters to the person? Are you listening actively? Are you on their territory? And are you picking up everything that's going on around you? But just in my last 2 or 3 minutes now, I want to run through the implications of the Health and Care Act, Clause 16, which outlined the functions of integrated care boards that comes into, is enacted next month. It's gone through all its parliamentary stages. And in that, the government accepted that palliative care is part of the NHS, that as an NHS core provision. That had never happened before. It was always an add-on extra, as we all know. And the amendment includes specialist palliative care provision. So what does specialist palliative care provision mean? This is on Hansard, that is the official record, and it does have legal status. And it is about having care in every setting, beds, including urgent admission to those beds. So if it's a Saturday and you've got an empty bed and somebody needs admission, they need admission then. Advice available at all times of the day, every day, 24/7 to other healthcare professionals around, with a 7-day service which is rapidly responsive to people and patient-centered, with the skilling up the workforce, making equipment and medication available, with a point of contact for people looking after someone at home, where relatives can actually phone and get on-the-spot advice. Sharing information about what a person needs, that means IT systems being looked at, making sure that they're compatible and information is handed on, having open conversations about what matters to a person, and providing education and training to others around and participating in relevant research and disseminating the evidence base. So it's quite a challenge, and I think that will mean quite a change for some services. But now that we're facing real difficulties financially across health and social care in a way that we haven't done before within the lifetimes of any of us, then we have to work differently in a different way to meet the needs of people around. Otherwise, we fail the population that we're there for. And I think we have to chuck out what I would call stupid rules. In COVID, we had lots of things happen, but there was a hangover from COVID now, I think, is an inappropriate risk aversion over infection. If somebody needs their closest relative with them, then they need them with them. And that person needs to be supported to be with them. If they're excluded, whoever is the patient risks getting disorientated, confused, falling, and we all know that falls can be fatal. And so in whatever service you're in, I think you need to ask yourself, have we got the balance of risks wrong? Are we failing to prepare the family adequately for when somebody goes home? Are we failing to adequately provide provision for a family that can't cope when somebody is at home? because being put in an ambulance and waiting outside an ED and dying there or in an emergency department is not how things should go. So that really means holding up a mirror to ourselves and thinking about what we're doing, because it's only by doing that that really we'll be able to get things right for patients and their families. And at the end of the day, we might be out of COVID or coming out of COVID. We're not out of it yet, but we must keep the patient at the centre of all that we do all the time. Thank you.